Hi,
How are
I'm
you?
doing well.
I'm Jenny.
Jenny, nice to meet you.
Nice to meet you. Um, I'm a student nurse from UIC and I'm studying to become an advanced practice nurse. Are you familiar with that role?
Yeah,
Okay. What's your name?
son.
Sun. Okay. Sun, what brought you in today?
I'm just here for a routine checkup.
Routine checkup. Okay. Since we're meeting for the first time today, can we start with some demographic data?
Sure.
Okay. Your full name
Sung Park,
and your date of birth?
January 28, 1988.
Okay. Your address?
3744 West Hamlin,
Okay. Your phone number?
773-344-1111.
What ethnicity do you identify with?
Korean.
Korean. Are you married?
No,
And what do you do for a living?
I own a sign business.
Sign business. Okay. And where do you usually go for healthcare needs?
My local hospital, Swedish Covenant Hospital.
Swedish Covenant Hospital.
We're a
Okay.
couple of blocks away.
Oh, nice.
Yeah.
It's always good to live by a hospital.
Mhm.
When did you last see a doctor?
A year ago.
What was the reason for the visit back then?
Same thing, and just a routine checkup.
Routine checkup.
Yeah.
Okay. Do you have any known medical or mental illness?
No, I do. I have these migraines that come and go.
Migraines?
Yeah, once every 3 months.
Oh, okay. And when did it first start?
18, I think, around that time.
You
I
mean
first
when you were
started
18
college.
years old?
Yeah.
Okay. How would you describe the quality of this?
Migraine, it's just won't let me do work whenever I have these migraine attacks.
Okay. Would you say it's like a throbbing pain, sharp pain? How would you describe this pain?
It's a mix, sharp and throbbing.
Okay. So you mentioned it comes about once every 3 months, and when it does come, how long does it last?
Probably like a couple of hours, 3 or 4 hours in a day.
What do you do to relieve that pain?
Take over the counter, like Tylenol or Advil.
And it helps?
Yeah.
Okay. All right. About to your best knowledge, is your immunization up to date?
Yeah.
Okay. Specifically, this Tdap vaccine. Do you know where you last got it?
I probably when I was in high school.
When you were in high school?
Yeah.
Okay. It's typically recommended every 10 years we get a booster, but we'll look into it and
Okay.
get you taken care of. Did you ever have pneumonia vaccine?
No.
Okay. What about flu vaccine?
I should have got one, but no.
Are you interested in getting one this year?
Yeah, sure. Do you guys offer that?
We do.
Cool.
We'll get you one today. What about hepatitis B vaccine?
I believe I got that when I was in grammar school.
Awesome.
Yeah. Or
Great.
middle school.
To your knowledge, are you allergic to anything
No.
actually? So any drugs?
No.
Food?
No.
Environmental components?
No.
Like pollen?
No.
None of that? Okay. Have you ever been hospitalized?
No.
Okay. So you never sustained any injuries,
No.
surgeries in the past?
No.
Okay, perfect. Do you use any alternative therapy?
No.
Any chiropractics, acupuncture, vitamin therapy, oriental medicine?
No.
None of those? Okay. Are you taking, aside from the over-the-counter Tylenol that you take as needed for your migraine, are you taking any other medication?
No.
Do you take any other, like any herbs, multivitamin? None of those?
Nope.
Okay. How many siblings do you have?
I have an older brother who is 37.
Okay.
Yeah.
Is he generally healthy?
Yeah.
Does he have any chronic illness that you know of?
No.
Okay. What about your parents?
They're 65 and my dad's 65 and my mom's 60. They're healthy also.
They don't have any chronic illness?
No.
Okay. What about your grandparents?
Grandparents are good, but they passed away with with diabetes.
So they had diabetes
They had
when they were
diabetes,
alive.
right.
What were the cause of their death? Do you remember?
I believe they had a stroke. My grandfather passed away with a stroke, and my grandmother also.
And are these from your dad's side?
Yeah.
Okay. What about your mom's side?
My mom's side, my grandmother passed away with a stroke also, and
Okay.
unfortunately, my grandfather fell down the stairs and passed away that way.
Oh, okay.
Yeah.
What about your aunts and uncles?
My uncle on my dad's side has stomach cancer,
Okay.
and my aunts from my dad's side are healthy.
Okay. How old was your uncle when he passed away?
He was in his 50s.
Okay. What about your aunts and uncle from your mom's side?
They're all healthy.
Oh,
Yeah.
good. Okay. Within your nuclear family and your extended family, do you know if they have any allergies to food, drugs, environmental components? Or
No, they're all
no allergies?
no allergies.
Do they have any heart disease?
No.
High blood pressure?
No. Oh, high blood pressure kind of runs through my family.
Okay.
My dad's side and my mom's side, so
Do your parents have high blood pressure? Do you know?
I think they do. They always get mad at me, but no.
What about your brother?
And I think he does also.
Okay. And you said stroke. There were 3 grandparents that died of stroke.
Right.
And what about asthma?
No.
Diabetes?
Yes.
Who?
My grandmother and grandfather from my dad's side.
From your dad's side? Oh, yeah, you told me.
Yeah.
I'm sorry. And cancer, the only known cancer is your uncle?
Yeah.
Okay. Any thyroid disease?
No.
Any blood disorders?
No.
Vision or hearing problems?
No.
You wear eyeglass. Are you
Right.
the only one that wears eyeglass in the family?
No. My grandmother had one. Grandfather had one. My mom has one. My brother has one.
Okay.
So it kind of runs through my family to have glasses.
Yeah. Any genetic problems or birth defects?
Nope.
Any seizures?
My brother had a seizure when he was a child. He was in a setting where there was a lot of music, but that was the only known seizure case.
Oh, okay. So it only happened once to him.
Yeah.
All right. Any mental or emotional problems?
No.
Any cognitive problems?
No.
Learning disabilities?
Nope.
Behavior issues?
Nope.
Alcohol abuse?
Nope.
Obesity? Are they generally of healthy weight?
No, my brother and I are kind of big.
Your brother and and you?
Yeah.
Okay. Of the positive diseases like the cancer that happened to your uncle, the stroke, the high blood pressure, are you concerned about any of these happening to you?
Yeah, the high blood pressure, especially, and the obesity that I have, I do kind of want to tone it down and avoid anything that would happen in the future.
You know, that's good that you mentioned that, because there are modifiable lifestyle changes you can do to decrease your weight, and even if you just lose 5 pounds, that will make a difference in your high blood pressure.
Oh.
If you have one, I mean, we'll check. if
Okay.
you have.
Cool.
But my point being, there are lifestyle changes you can do.
Cool.
Okay, to decrease your risk factors for developing these diseases. Okay. Do you live with anyone?
I live by myself.
By yourself?
Yeah.
Okay. The neighborhood that you live in, is it relatively safe? Any violence, crimes?
Fairly safe.
Fairly safe. Okay. You say you have a sign company. Did you ever work as other careers before?
No.
That was your only career?
Only
Okay.
career, yeah.
I don't know much about what you do, but is there any occupational health hazards involved that you can tell me about?
Yeah, machinery and the tools that we use. We weld a lot. So all the welding fumes could get in your lungs. Painting, all the paint fumes could go also in your lungs. And our printers have some fumes that could be also harmful.
Do you wear mask at work when you do these jobs?
For the painting part, but the printer and the welding, no.
Okay.
Yeah.
Maybe look into that.
Yeah.
Okay. How many years of education did you complete?
2 years of college.
2 years of college?
Yeah.
Okay. With the job that you have, do you feel economically secure and do you have adequate access to medical resources if
Yeah.
you need?
Yeah.
Okay. Do you smoke?
No.
Ever?
Never.
Do you drink alcohol?
I drink probably on average a beer a month. I'm not a heavy drinker.
1 beer a month, occasional?
Yeah.
Are you a coffee drinker?
Yep.
How often?
Probably 3 or 5 times a week.
3, 5 times a week?
Yeah.
Okay, that's occasional.
Mm-hmm.
Do you use recreational drugs?
Nope.
No? Okay. How many hours of sleep do you get?
I'm like yawning. 4 to 6 hours a day.
That's not many.
No, it's not.
Do you feel rested?
Surprisingly, when I wake up, I feel like I'm ready to go to work. But during the day, I get very tired.
Do you have a chance to take a nap during the day?
I wish I can, but no.
Do you exercise regularly?
I used to, but nowadays, no.
No. That's recommended, but if you're busy, you're busy.
Right.
Try to find some time though to
I will.
exercise.
Yeah.
Can you tell me what you had to eat for the past 3 meals?
A well-balanced Asian diet, with rice, soup, vegetables, some proteins and carbs.
Good.
Yeah.
So your intake is variable. You have vegetable, protein, carbs.
And then like some chocolate during the snack time. So that's why I have obesity.
No.
Yeah.
How often would you say you go out to eat?
Probably once a week.
Okay.
Yeah.
Okay. Do you practice any special dietary restrictions? Like, you know how some people are vegans. Do you have
No.
restrictions?
Oh.
No.
I
Okay.
eat anything.
You eat
That's
everything.
on my planet.
Do you experience stress in your life?
Every day, every second, every minute of my life.
Oh no.
Yeah.
I'm sorry. From what?
From work.
From work. How do you relieve that stress?
Work more.
You're funny.
Just learn to breathe a little bit, deal with the problems, and then move on to the next problem.
Has it ever gotten so bad that you sought professional help to manage your stress?
No, I just like to talk about it. I think that's a good way to relieve the stress you get from work.
To your family and friends, you
Right.
are able to talk about it, and
If they want to cure the common problems every day, but that's helps me a lot.
okay.
Yeah.
Well, that's good.
Mhm.
Have you or your family ever witnessed or experienced violence?
No.
No. Okay. Do you practice a specific religion, sir?
My family practices Buddhism.
Buddhism.
Yeah.
Do you?
Occasionally.
Okay.
If I don't get into a fight, I feel like I practice Buddhism.
Does a religion affect your healthcare?
I don't think so.
Okay. All right. So now let's go over your body systems. Okay, we'll just talk about how you feel. How have you been feeling in general recently? Any fever, chills, fatigue?
Fatigue.
You've been
Yeah.
feeling tired?
Probably just from working too much, but other than that, I'm very healthy. I feel like.
Okay. Okay. Any weight changes recently?
Yeah. A big weight gain.
Weight gain?
Yeah.
How much?
20 pounds
20 pounds?
Yeah.
Over how long?
a year.
Okay. Well, why do you think that is? Is it stress? Overeating?
Stress and overeating.
Okay, we're
Yeah.
gonna have to talk about this.
Okay.
Do you have any pain?
Back pain from sitting too much from the computers.
Currently, do you have any pain?
right now I kind of like have to move around to adjust to a good setting, but I'm fine.
Okay. Do you notice any changes in your skin quality, your nails?
No, everything is fine.
Do you use sunscreen regularly?
I do not.
That does prevent skin cancer.
Mm,
Okay.
good thing I use my computer. I don't go out as much.
But when you do go out though, where there's sun, you should wear
Right.
sunscreen.
Right.
Any changes in your hair?
I am balding. I am losing hair.
It looks full to me.
Does it? Mm.
Does that run in your family? Does your dad?
My dad is balding.
Oh.
Yeah. Our is bald.
Does that worry you?
Of course, man. I'm a young guy. I want all
Right
my
now
hair.
you look fine.
Thank you.
Yeah.
Yes.
But when you feel like you're starting to lose more hair, maybe we can talk about what we can do
Okay.
in terms of products and things we can do to
Cool.
prevent that
Very
loss.
good.
Do you follow up with an optometrist regularly?
No.
No? You should. You do wear eyeglass, right? Our eyes do get worse from year to year, and your prescription might need to be adjusted from like every now and then. I would recommend that you see your eye doctor maybe once a year, or when you feel like your vision isn't as
Okay.
good.
Yeah, for
Yeah?
sure.
Okay. Any problems with hearing?
No.
Any pain or abnormal discharges from your ear?
No.
Any ringing in your ear?
No.
Any dizziness?
No.
Any hearing loss?
No.
Okay. Any problems with your nose?
No.
Like nosebleeds?
Just dry.
Just dry nose? Oh yeah, Chicago winter is very dry air. Maybe use humidifier, like, when you go to sleep.
Yeah, I'm gonna talk to my girlfriend about that one.
Okay. Do you have frequent cold?
No.
Okay. We have sinuses, like especially around your nose. Do you ever have sinus pain?
It feels congested.
Okay.
Yeah.
Sometimes.
All the time.
All the time.
Mm.
Does that bother you?
Yeah, it does kind of.
What do you do to relieve that?
I just let it go. I should go see the doctor about it.
There's a over-the-counter, like the saline wash
Mhm.
that might help.
Oh, I'll give that a try.
Okay.
Yeah.
Do you see a dentist regularly?
No. I should.
Okay. Do you practice good oral hygiene though?
Yes.
Brush your teeth, fresh. Yeah.
Yes.
Any missing teeth?
No.
When was the last time you saw a dentist?
8 months ago.
Okay. Okay. Good oral hygiene is important for your health too. Sometimes like lung diseases can start, from bad oral hygiene.
Wow. Okay.
Yeah. Any neck pain or stiffness?
Yeah. Neck.
Neck?
From
Is it
sitting
related
too much. From sitting too
working sick? Okay. All right. Is it bad?
much. No. It's bearable.
Okay. I mean, I would recommend you routinely exercise your neck, just like doing range of motion
Mm-hmm.
so it doesn't get stiffer.
Okay.
Okay. Any soreness of lumps in your breast, like around your breast area? Lumps? Okay. Any abnormal discharge from your nipple?
No.
I'm sorry. That's some people find that funny. Any breathing issues?
No.
Coughing?
Oh, I cough whenever I have like a cold. It lasts about 2 weeks, 3 weeks.
Okay. Currently, have you been coughing?
No.
Okay. Any shortness of breath?
No.
Have you ever had chest pain?
Yeah.
Tell me about
Sometimes,
it.
just whenever at work I have these anxiety attacks and they feel like chest pains.
When was the last time you had it?
Just like last week, we had a project that went sour and just couldn't breathe correctly. But
It sounds like you feel like it's stress-induced
Yeah.
chest pain.
hmm
Okay. How would you describe the quality?
Not comfortable.
Is
But
it localized to your chest?
wherever that is, yeah.
Does it go to your shoulders?
No, just my chest area.
Just your chest area? Okay. And did it spontaneously go away?
I would walk around outside, just give myself a breather,
Okay.
and then come back to work again.
Okay. And then that pain will go away, or it still stays?
It gets better.
Okay. All right. You said there aren't any heart diseases that run in your family?
No.
Okay. Okay. We can revisit that next time you have chest pain, okay? Have you ever told that you have high blood pressure in the past?
Yeah. From doctors I've seen before.
Okay.
Yeah, they did some tests on me and they did tell me that I have high blood pressure.
But you're not on any medication?
No.
Okay. It could be that it was
Not too high.
Yeah, an isolated finding. Like sometimes when you're anxious, your blood pressure can be higher. But we'll check it again today and see what it is. Okay. Has anyone told you have high cholesterol?
No.
Any abnormal heart sounds?
No.
Any stomach issues?
No.
Abdominal pain?
No.
Constipation? Diarrhea?
Constipation once in a while, but
Okay.
yeah, I take fiber gummies and they
Good,
help a
good.
lot.
Any nausea, vomiting?
No.
Intolerance to food?
Nope.
Swelling by the groin area?
Nope.
Any rectal bleeding?
Nope.
Okay. Any problems with urinating?
Nope.
No blood in the urine?
Nope.
Any infections, the urinary tract infections in the past?
Nope.
No? Okay. Any abnormal discharge?
Nope.
Okay. Are you circumcised?
Nope.
Okay. When was the last time you had a prostate exam?
Oh, never. I never got one.
Okay. Are you concerned about fertility at all?
Yeah.
Why are you concerned about fertility?
Oh, I'm sorry. No, I am not. I feel like, but I should if I've never had a test before. So, should I?
Does that like any people in your family have fertility issues?
No.
Yeah. Well, I think I think right now we don't need to worry about it, but when it comes to time where you want to have a child and you try for a year and still no result, then we can investigate if that worries you then. Aside from this neck stiffness from work related, sitting too long, do you have any muscle problems?
No.
Like, can you stretch in all directions? Okay. No limitations with limb movement?
No.
Okay. Any weakness?
No.
Swelling?
No.
Pain in your muscles?
No.
Okay. How's your memory?
They come and go. They're good on a good day and bad on a bad day. So.
Generally okay?
Right.
All right. Any head injury in the past?
No.
Any episodes where you passed out?
No.
Any seizures?
No.
Any numbness or tingling in your muscles?
No.
Okay. How's your mood been? Do you find that you're irritable? Or do you feel like your mood has been pretty stable?
Mood is pretty stable. It's just up and down at work only. But after work, pretty stable.
Okay. Yeah. Okay, so it sounds like work is really stressful, huh?
Right.
Okay. Have you ever had blood transfusions in the past?
No.
Have you ever been told that you have anemia?
No.
Abnormal bleeding?
Yeah.
Or whenever you bleed, does it take a long time to clot off?
No.
Okay. Any thyroid problems?
No.
Do you feel like you have unusual sensitivity to hot or cold environments?
No.
No? Okay. Do you feel like you have intense thirst even though you drink enough water?
No.
Excessive hunger?
All the time.
Not to be seen as a joke, but do you feel like even after eating one adequate meal, you're still hungry?
No.
Okay. Are you sexually active?
Yeah.
With men?
No,
Women?
with women.
With women.
Yeah.
Do you practice safe sex?
Yes.
With what?
Condom.
Okay, good. Are you in a relationship currently?
Yes.
Okay. And I don't know if this is a problem for you, but sometimes patients of mine, they have abusive relationships, but they're hesitant to bring it up. So then I start asking this question to my patients routinely. Would you say that your relationship is healthy?
Yeah, very healthy.
Free of violence?
Yeah, free of violence.
Good. Do you have any concerns that I didn't ask about?
No.
No? Okay. And I think that's all my questions. Do
Cool.
you have if you need anything, just let our clinic know.
Will do. Thank you so much for your time, Jenny.
Thank you.
Yep.